Hi, my name is Dr. Asha Abdullah. I am a resident consultant of obstetrician and gynecologist, 𝐀𝐬𝐡𝐚𝐫 Ampang Puteri Specialist Hospital. Cervical cancer is fairly common in Malaysian population. It is second cause of all the cancer in women aged between 15 to 44 years old. In early stage, sometimes they present without symptom, only pick up during the cervical smear screening procedure. If they had symptom, normally in the form of abnormal vaginal bleeding, which include intermenstrual bleeding, post-coital bleeding, or post-menopausal bleeding, or prolonged, so-called prolonged period. In late stage, they normally present with foul-smelling vaginal discharge. The factors that increase the risk of cervical cancer include multiparity, that means those who have a high number of births, those who has early sexual contact, those women who practice promiscuity or had contact with so-called high-risk male, i.e. male that has many partners. Also common to see among the smokers. The most important way to detect cervical cancer is through screening. There are a few methods that we normally employ in the screening procedure. The well-known procedure is they call pap smear or papillomavirus smear, whereby we take a smear from the cervix during the vaginal examination. Secondly is using a liquid cytology, we call thin prep, whereby we take the sample from the cervix using a special brush and dip into the liquid media, and later on process into the slides. This is seems to be getting a better yield. Of course, there are other methods whereby you can do it yourself at home using a special technique whereby we can test the DNA or HPV DNA through the sample. And lastly is what we call HPV DNA study, whereby we take the procedure is just like thin prep preparation, but we include the study of the DNA of the HPV. As you know, HPV is one of the main cause of cervical cancer. There is no specific age group, but more important is once you are exposed to sexual intercourse, whatever age, you should go for cervical smear screening. As we know that the main cause of cervical cancer is related to HPV or human papillomavirus infection. There is a schedule that you got to follow when you take this vaccination. We assume that it lasts for lifetime. Just now I did mention about HPV virus as a cause of cervical cancer. We're going to talk more about the virus as well as the vaccination against this virus in the next video.